What's up, guys? Dr. Luke here with RecoverX Physical Therapy. I'm here with another episode of Should I ... do this or that? All right. As you saw in my first episode with Should I Rest or Ice, it was a really common question that I get here in the clinic at RecoverX, and quite frankly, a lot of therapists get around the world, really. Today's episode, another very, very common question I get after injury. And this one is really important, right? It's really important to understand when you should rest it or push through some discomfort, all right? And I mean, it's the number one thing that I think people start to think about when they have an injury and they start to get back or start to try to get back to the things that caused the injury, all right? Let's take the example of someone with some shoulder pain, all right? Maybe they were in the gym, they were doing some bench press, and then all of a sudden they felt this pain in the front of their shoulder. And, you know, they pushed through it a little bit that day. They woke up the next morning and they're like, man, that really hurts. That doesn't feel normal. That doesn't feel like normal soreness, normal pectoralis soreness. That feels like pain, all right? And they start to go through the things in their head again. One, should I ice it or should I heat it? I think two, though, should I just try to rest this or, you know, do I try to push through this a little bit? So, you know, I think a typical course at that point would be someone tries to rest for 2 or 3 days and then they try to do the thing that caused them discomfort. And usually at a lighter weight, right? They might go back to the gym, they might grab some lighter dumbbells and try to bench press again, and it hurts, all right? It hurts. So now it's really that main question. Do I rest it? Or do I push through some of the discomfort, right? And obviously, talking to a specialist would help, someone like a physical therapist, a physician, a chiropractor, someone that's going to give you some real clinical value judgment and assessment. That would be your best route. But I think early on, you should ask yourself these 3 questions about whether you should rest or push through discomfort. 1, is that pain present at all times, or is it waking you up at night? You know, that pain that's just kind of not going away, right? If it's that kind of pain, we want to rest it. We want to rest to and, you know, if it's not getting better after a week, you need to go get it checked out. You need to get it assessed by a professional, right? So that's one reason you should rest it, all right? 2, you should rest it if that thing that's giving you problem, that movement that's giving you issues, that the movement that you hurt it on still hurts, right? So that second time you tried bench press, don't keep trying that every day, right? An injury, a typical injury can take, the very minimum is usually 7 to 10 days, but a lot of times it could be up to 3 to 4 weeks or longer. But, you know, when you're talking about that 3 to 4 week mark, you need to be doing the right things to help with recovery, and that's where the specialist comes in. But definitely don't try every day to see, is it feeling better? Is it feeling better? Then you're kind of re-aggravating that injury. All right, couple reasons to rest it, right? Not one other reason to be rested, you know, if it's hot, if it's swollen. Definitely if it's swollen, you're not going to want to try to push through any sort of discomfort. The knee would be a good example of that. If you have a swollen knee and you don't want to try to push through that, okay? All right, when should you push through some discomfort, right? Like, when should I push through a little discomfort? You know, a lot of people are afraid that they're doing more damage than good, and they're afraid they're going to tear something or rip something. But let me be honest, our bodies are very resilient. We're very anti-fragile, and you can push through some discomfort. And in fact, you need to, because it needs to tell the brain that's responsible for your pain, that it's okay to move again. It's okay to feel a little bit of discomfort. You're not going to be doing damage. So when do you do that, right? When can you start to push through some discomfort? If you are just feeling stiffness, feeling tightness for those first couple reps, and it's just stiffness, not sharp pain, then you might say, oh, okay, let me step back here. Is that just kind of stiffness? Let me do a couple more reps. Oh yeah, it's starting to feel better. It's starting to feel like I have more motion through that bench press. It's not painful. And then afterwards, you don't have residual pain. You don't have that residual kind of achiness that occurred early on in the injury. Then you can kind of push through that discomfort, that stiffness type discomfort, all right? You don't want to push through pinching, sharp pain, those types of things, all right? Push through some tightness. It gets better with the more reps that you do. That's when it's okay to push through some discomfort, all right? It's a very tough call, and that's why it's really important to maybe have a professional assess the situation, someone who's skilled and knows how to assess what you're specifically dealing with, whether it's a shoulder, a knee, or an ankle, all right? Okay, so that does it for our episode of Should I Rest It or Push Through Some Discomfort? Remember, you're resting, acute pain, when you're having swelling, when you're not able to do that movement that you're trying, you need to rest, okay? Injuries take time to recover. When you're gonna push through it, tightness, with each rep it gets better, right? Push through a little discomfort that way. Tell your brain it's okay to start moving again. And this is typically later on in the recovery process, all right? Thank you for tuning in. If you enjoyed this episode, there's gonna be more coming out. If you haven't checked out the rest versus heat or ice versus heat, check it out. Please subscribe to the channel. Obviously, you can share this video with your friends. That would be awesome to continue to help people understand injury and try to get better. Thanks, guys. Talk to you later.